Hello everyone. Today, we're exploring the medication loperamide, commonly known by its brand name, Imodium A-D. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Loperamide, known by its brand name Imodium A-D, is an over-the-counter medication used to treat diarrhea. It works by slowing down the movement of the gut, which reduces the speed at which contents pass through the digestive system, allowing for more water and electrolytes to be absorbed. Loperamide is particularly effective in treating acute diarrhea and can also be used for chronic diarrhea associated with inflammatory bowel disease. Additionally, it's used to reduce the volume of discharge from ileostomies. The drug became available in the 1970s and has since been a staple in managing diarrhea symptoms. Warnings: Loperamide should be used with caution. It is not intended for children under 2 years old due to the risk of serious heart problems. Adults should be cautious about using it in high doses, as it can cause severe heart issues, including QT prolongation, which can lead to arrhythmias. It's also essential to not use loperamide if you have a fever or if your stools are bloody or black, as these could be signs of a more serious condition. Additionally, loperamide should not be used for more than 2 days without medical advice, as prolonged diarrhea could indicate a more severe underlying condition. Before taking this medicine. Before starting loperamide, consider several factors. It's important to inform your healthcare provider if you have liver disease, as the medication is processed through the liver and may need dosage adjustments. If you're pregnant, planning a pregnancy, or breastfeeding, consult with your healthcare provider to understand the potential risks and benefits. Loperamide should be used cautiously in individuals with a history of heart disease or electrolyte imbalances. It's also critical to discuss any other medications you are taking, as loperamide can interact with certain drugs, including antibiotics and medications for heart rhythm problems. Side effects: As with all medications, loperamide can have side effects. Common side effects include dizziness, drowsiness, tiredness, and constipation. Some people may experience abdominal pain, bloating, or nausea. Serious side effects, though rare, can include severe allergic reactions, rash, itching, swelling, severe dizziness, trouble breathing, and signs of dehydration, extreme thirst, decreased urination, severe muscle cramps. If you experience any severe side effects, it's crucial to seek medical attention immediately. In rare cases, taking too much loperamide can cause serious heart problems such as QT prolongation, torsades de pointes, and other ventricular arrhythmias. Symptoms of an overdose may include severe dizziness, fainting, and fast or irregular heartbeat. If you suspect an overdose, seek emergency medical help immediately. Interactions: Loperamide can interact with other medications. It's essential to inform your doctor about all the medications, supplements, and herbal products you are currently taking. Specific drugs that may interact with loperamide include quinidine, ritonavir, and certain antibiotics, such as erythromycin, clarithromycin, among others. Dosage: Correct dosage is vital for the effectiveness of loperamide. For adults with acute diarrhea, the typical starting dose is 4 mg, 2 mg capsules, followed by 2 mg after each loose stool, not exceeding 8 mg per day for over-the-counter use, or 16 mg per day under medical supervision. For chronic diarrhea, the dose may be adjusted based on the response and the doctor's recommendations. It's essential to follow the dosage instructions carefully and not to exceed the recommended amount. Avoid: While on loperamide, it's advisable to stay hydrated, especially if you have diarrhea, to prevent dehydration. Avoid driving or operating heavy machinery if you feel dizzy or drowsy after taking the medication. Alcohol should be avoided as it can increase the drowsiness effect. FAQ: Many people wonder about the use of loperamide in children. While it can be used in children over 2 years old, the dosage needs to be carefully adjusted based on the child's weight and age. It's crucial to consult with a healthcare provider before giving loperamide to children. Another common question is regarding its use for travelers' diarrhea. Loperamide can be effective in reducing the symptoms of travelers' diarrhea, but it's important to address the underlying cause, such as a bacterial infection, which may require antibiotics. Closing. That wraps up our overview of loperamide, also known as Imodium A-D. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.